helps businesses have a bigger presence by making TV affordable. Beyond ads, biz brands can now have a channel presence with their content. We are the Netflix of biz brands. If you have a passionate message, the solution to a problem, a new book or product launch, and want to impact a new and expansive audience, have your audience say, I saw you on TV. PSI TV is proud to bring you another rising star, and this time in the bodyworks niche. And you will see why I seem a little bit confused in a bit, because we're actually speaking with Dr. Theresa Cody, and she is a dentist. So we're going to explore that. But she grew up in Brussels, Belgium, and then she moved to Texas. She earned her doctorate of dental surgery at the University of Texas in Houston. And then within a year of that, in 1992, within the next year, she married her husband, and who was also a dentist. And they had a practice in Sugar Land, Texas, which I understand she still has. So she is the founder and CEO of CNC Wellness. This is a natural healing center. Dr. Cody, how does one go from dentistry to bodyworks? Explain that to me.
Well, actually, my hairdresser got me into this, which is odd, but my hairdresser, she had trigger fingers. And from repetitive motion, doing hairdressing for 30 plus years. So she had gotten a steroid shot, and she, of course, got some relief for about 4 months. And then all the pain in her fingers started coming back. And I was in her chair, and I don't know what made me say it, but I said, Tara, why don't we try PRP, which is platelet-rich plasma. We've been using it in the dental office for 30 years when we do a bone graft, and I knew what there's not a lot of blood in the bone, so it allowed the bone grafts to take. But I had no idea how wonderful it was until Tara let me inject her hand. And she could not close and make a fist. Her hand was about, let me see, I can't do it, like that. So she sends me a picture the next day, and her fingers are touching. And then she sends me a picture the next day, and she can make a fist. And I went, oh my, I thought, she asked me how long before she saw anything, and I said, 6 weeks. No, 2 days. So that's where my exploration into platelet-rich plasma began, because I saw such rapid healing. And so then I found out all about vampire facials, and
I want to talk about that in a moment. Hold on 1 second.
We run it through a centrifuge, with which the red blood vessels drop to the bottom and the plasma sits on top. And we take that and put that back in.
Wow, you might be onto a whole new industry direction. I don't know. Have you been teaching your other doctors this? You probably should.
Yeah. Yes, yes.
Okay. Well, on that note, you mentioned the vampire facelift.
Well, the vampire facelift is the idea of using those healing factors to improve your skin quality and reduce pore size. And because it makes new blood vessels, you get a better glow about you, and increasing collagen, which is the glue underneath your skin that lifts your skin. So basically using it to make you look better, younger, healthier.
So no need for plastic surgery?
Well,
or not can delay it. That sounds interesting. So I was on your website and I saw something about an O shot. Tell me about the Okay.
Okay, the
We're all adults here. Let's talk about the O shot.
The same healing factors. So we inject those healing factors into, and hold it, the clitoris and in the vagina. Now, it sounds horrible, but it's probably the easiest of all the procedures. That tissue is very much like gum tissue in the mouth. It's very similar. So a topical application of lidocaine really, really numbs it up. So it's actually one of the easiest things. So it reduces incontinence, which is an interesting side effect, but it also increases sensitivity. So you have more feeling. And we've also treated a woman who had lichen sclerosis, and it's like a deterioration of the skin. And there's not much available for those patients. And in 2 treatments, she completely healed up after having it for 2 years. Mm-hmm.
Wow. 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 Okay. So older women who may not be feeling so romantic may find that the O shot actually zips up their love life. Is that what we're saying here?
That's what we're saying.
Oh, wow. Wow.
But it really have younger women who they can't run anymore. They can't do anything without leaking. So that's a big, they just want an improvement in life.
Sounds like
not to wear a diaper.
In addition to your dental chair, you need a whole new type of chair for that.
Yeah, this is a go. Well, I do have a medical director and I have a nurse on staff. I don't do this.
Okay.
I'm focused on the other end. I can do the face.
Oh, okay. All right. I hear you. So with all this talk about vampire facelifts, O shots, plasma, PRP was plasma.
Rich, platelet-rich plasma.
Platelet-rich plasma. Who is all this for? Who is the target audience? Who would benefit the most from, I mean, some of that's come out of what we've talked about, but just in general, who are you going after for stuff like this?
Well, I started the wellness center with the vampire facial and facelift kind of in mind, and then realized all the other things that it helped. So we've treated diabetic wounds, plantar fasciitis, any kind of joint trauma, ligaments, tendons that are hurt, muscles, arthritis. If you get it into the joint, it helps reduce arthritis. And there are many studies who show this. This is a very common treatment in professional sports because they got to get back on the field so quickly, right? And also, you ready for this? Equine medicine, horse medicine.
Ah, horse medicine. Okay.
So my neighbor has 3 horses. So I told her, oh, I started a wellness center and we use PRP. She goes, oh, I know all about that. And I said, you do? And she said, oh, yeah, that's the first line of treatment they want to use on horses when they hurt themselves.
Wow.
For the last 15 years.
That's amazing because I don't think that's mainstream for wounds. I mean, I'm thinking right now of family members who've had diabetes and issues. It never came up as an option. And it sounds to me from what you're saying that the athletic world already knows this secret of getting back up and running really quickly. And it sounds like it has applications in many other.
Well, and it's safe. It's you going back into you. You're not taking it from anybody else.
Ah, right.
Your blood, it's your plasma. There's no possibility of rejection. The worst that could happen is no improvement. But I have not seen that. Not yet. I'm waiting.
So in other words, you're fast tracking what the body would have done. You're just kind of zeroing in on the hot spot and fast tracking the experience.
Yes. Oh. We're concentrating the healing factors that are already there in an area that we want to heal. Tendons and ligaments have a hard time healing. There's not a lot of blood flow. So that's why it works so well for them.
Gotcha. Well, Dr. Cody, is there anything else that you'd like to share? I mean, this whole thing has been a whole new conversation for me. So is there anything else you'd like to share?
Well, I just wrote the book to let people know, because like you said, you have a family member who has a diabetic wound that they do not get better. It's a terrible, terrible thing. And this is just an option that people need to know about.
Well,
now there is
Where are you?
I'm outside of Houston, Texas.
So if they were interested in this, they'd have to come to you, or are you training doctors and have a directory? How is that working?
No, I'm not training doctors, not yet. I might have to. I was trained under Dr. Runnels on the vampire facelift, but so yeah, I know. And one of the problems is that insurance won't pay for this. They don't want to pay for this. Okay. But we charge a very low fee for any body part.
So it sounds like it's worth a trip to come see you in Texas. There we go. Texas tourism will thank you. All right. Well, is there anything else?
Just that this is the most miraculous thing I've ever seen. I mean, we knew it worked in dentistry because the bone graft and then you can put an implant in. But it works everywhere because it is your body's healing.
It seems to be that way for sure. But it's cncwellness.com. Dr. Theresa Cody has been my amazing guest today, the dentist who is working in body work as well and introducing a long time practice to a brand new experience, and still so brand new that I can tell you, I'm in Tampa, Florida. I doubt I could find somebody offering that for wounds and for facials here. But guys, vampire facelift, shots, healing, Dr. Cody, cncwellness.com. Thank you for joining me here on PSI TV. True to Your Mission, Dr. Cody, thank you so much.
Thank you.